Imagine waking up one day with a dull ache in your abdomen. You brush it off, thinking it's just a stomach bug. Days turn into weeks, and that ache becomes a persistent companion. Eventually, you find yourself overwhelmed with bloating, fatigue, and unexplained weight changes. What you may not realize is that these seemingly harmless symptoms could signal a silent threat lurking within, mucinous ovarian cancer. Today, we're diving into the depths of mucinous ovarian cancer, a rare and often misunderstood form of this disease. By the end of this lecture, you'll understand the symptoms, the diagnosis process, and the treatments available for those facing this challenge. Let's shed light on this crucial topic. Your health could depend on it. What is mucinous ovarian cancer? Mucinous ovarian cancer is a rare subtype of epithelial ovarian cancer, accounting for approximately 6% of ovarian carcinomas. The term carcinoma refers to cancerous epithelial tumors, which arise from the cells covering the ovaries. While most ovarian cancers are serous carcinomas, mucinous tumors develop from cells that produce thick mucus. These cancer cells can be tricky. They can resemble other types of cancer that originate in the gastrointestinal system, making diagnosis a complex puzzle. The background of ovarian cancer. Ovarian cancer, in general, is notorious for being diagnosed at later stages. This is mainly because early-stage symptoms are often subtle or easily mistaken for other conditions. Interestingly, about 80% of mucinous ovarian cancer cases are diagnosed in stage 1, where the cancer is still localized. This highlights the importance of understanding the unique characteristics of this subtype. Understanding the symptoms. So, what should you look out for? Mucinous ovarian cancer often presents itself with symptoms that can easily be confused with other ailments. Common symptoms include pelvic and abdominal pain. This may start as a dull ache but can escalate to severe discomfort. Bloating, a feeling of fullness or swelling in the abdomen. Fatigue, feeling unusually tired or drained, even after adequate rest. Weight changes, unexpected weight loss or gain. These symptoms can lead to a diagnosis if they persist and prompt a visit to a healthcare professional. In some cases, symptoms like extensive blood clots have been the surprising catalyst for a diagnosis. Recognizing these signs early can be key to catching the cancer before it spreads. How is mucinous ovarian cancer diagnosed? Getting a diagnosis can feel daunting, but understanding the process can ease some anxiety. Diagnosis typically involves several steps. 1. Pelvic exam. This is often the first step, where a healthcare provider checks for any abnormalities. 2. Ultrasound scan. This imaging technique helps visualize the ovaries and surrounding structures. It can be done externally or via a transvaginal approach for more detailed images. 3. Blood tests. Doctors will often check for cancer markers like CA19, CA125, and carcinoembryonic antigen, CEA. Elevated levels can guide the diagnosis and indicate how well the cancer is responding to treatment. 4. Biopsy. This is a crucial step where tissue samples are taken, usually during surgery, to confirm the diagnosis. 5. MRI scan. An MRI can help determine whether the cancer is a primary tumor in the ovary or if it has spread from another site in the body. The challenge of understanding the cause. Currently, the cause of mucinous ovarian cancer remains unclear. Researchers have identified tobacco smoking as a potential risk factor, but this link isn't as strong as it is with other forms of ovarian cancer. Interestingly, while many types of ovarian cancer are more common in older women, mucinous ovarian cancer often appears in women between the ages of 20 and 40. This shift in age demographics is crucial for awareness and early detection. Treatment options available. Now, let's tackle the most pressing question: what happens after diagnosis? The primary treatment for mucinous ovarian cancer is surgery. The goal of surgery is to remove all visible cancer or tumors larger than 1 centimeter, a process known as optimal debulking. This can involve removing the ovaries, cervix, uterus, and sometimes the appendix, especially if there is a risk of spread to that area. While some patients with early-stage mucinous ovarian cancer may require no further treatment after surgery, those with advanced disease might face additional challenges. Platinum-based chemotherapy, often effective for other types of ovarian cancer, has proven largely ineffective against mucinous ovarian cancer. Research indicates that response rates for this chemotherapy range from 12% to 35%, significantly lower than the 70% seen in high-grade serous carcinoma. The outlook, what to expect. The outlook for mucinous ovarian cancer depends on several factors, including the stage at which it is diagnosed. Early stage diagnosis, if detected in stage 1, the 5-year survival rate is about 90%. This statistic is crucial. It underscores the importance of recognizing symptoms early and seeking medical advice. Later stages, unfortunately, if the cancer is diagnosed at a more advanced stage, the prognosis worsens significantly. For those with metastatic mucinous ovarian cancer, life expectancy may range from 12 to 30 months. It's essential to remember that these figures are estimates based on previous studies. Every individual's journey is unique, and factors such as overall health and the extent of the tumor can influence the outlook. Conclusion: mucinous ovarian cancer may be rare, but it's crucial to shine a light on its symptoms, diagnosis, and treatment options. By being aware of the signs and understanding the complexities of this disease, you empower yourself and those around you to seek help when it's needed most.